Here we go. Hello, and thank you for watching this program on how to create a Medicare policy and procedure manual. There's no audio taping or videotaping, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not intended to be legal advice. Target coding does not engage in providing legal services. If we talk about CPT codes, just a reminder, it's a registered trademark of the AMA. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotler. I am a chiropractor. I'm also certified in CPT coding. I'm a certified professional compliance officer. My areas of expertise include Medicare, HIPAA compliance, CPT and ICD-10 coding, chiropractic record keeping, treatment plans, and how to create compliant cash plans. I've written many books on billing and coding and documentation for chiropractors. I write articles for Chiropractic Economics and Dynamic Chiropractic, plus I'm a guest speaker at many state association conferences nationwide. So I'm going to ask you a question. We're going to start off with a question. Why do you even need a Medicare and policy procedure manual? It's also known as a Medicare OIG compliance plan. So why do you need this? Well, first let's go through some of the basics here. First of all, what does OIG stand for? OIG stands for Office of Inspector General, and the purpose of the OIG is to protect federal programs such as Medicare, Medicaid, and any other federally funded program. So the mission of the OIG is to prevent billing and coding errors, is to educate providers on how to prevent fraud and abuse, and it's to protect these federally funded programs, which are prone to a lot of fraud and abuse. Now, chiropractic care is covered in the Medicare program, so the OIG overlooks chiropractic services and does analysis of chiropractic services. There have been 9 reports on chiropractic done by the Office of Inspector General over the last 12 years. There are the cover pages for many of them, and they're not good. They typically find inappropriate billing has occurred, and services were billed for active treatment, but in essence, they were maintenance care. So there have been many of these OIG reports. Some of them are specific to certain practices, but they all typically are discussing how our documentation is inadequate, and this makes them leery of paying our services. This one here from October of 2016 talks about how hundreds of millions of dollars was paid out to chiropractors, according to the Office of Inspector General, inappropriately. These were for services that looked like they were not medically necessary. So there was a deep dive into these. This is another recent one where one particular chiropractor from Brooklyn, New York, received hundreds of thousands of dollars in payments from Medicare that they believe were inappropriate. So there have been all these studies and reports on chiropractic. So what happens is, after these reports come out, the OIG reports this information to the Medicare carriers. And I look at the OIG like the advanced scouts for regular insurance companies too. So, for example, if the OIG finds that chiropractic services are not being billed properly, yes, that gets reported to Medicare, Medicaid, and federally funded programs to look out and make some concerted efforts to prevent that and educate providers. But what about Aetna, Cigna, United Healthcare, Blue Cross Blue Shield? They're aware of these documents too, so they want to take a look at what we're doing to make sure we're billing properly. And every year, the OIG puts out something called their work plan. And unfortunately, chiropractic is mentioned in the work plan often. Here it is on page 20, where it talks about chiropractic services. When a healthcare profession is included in these OIG work plans, it's almost as though they're saying, hey, you're on notice, we're watching you. So because of that, there's more of a chance that you will get audited. There's more of a chance that a typical chiropractic practice will be looked at by Medicare because of these OIG reports that have come out. So Medicare and the OIG, they want providers to be proactive, especially when it comes to proper billing and coding. This includes many items. One of the most important items that Medicare wants you to do is have formal staff trainings, and you need to document them in a training log. So for example, if I were to ask you a question, hey, Dr. Smith, do you have trainings with your staff? There's a good chance you will say, yes, we have trainings with our staff. But that's not enough. You have to write down that you have the trainings, the topic of the day for that particular training, document who attended, and keep those logs on an ongoing basis. I'm going to show you a sample in a few minutes. So back to the question, why do you need a Medicare policy and procedure manual, also known as an OIG compliance plan? Because it's required. It's required if you treat Medicare, Medicaid, TRICARE, or any other type of federally funded program patient. So back again, the main purpose of Medicare compliance is to prevent billing and coding errors. Now, don't confuse that with HIPAA compliance. The main purpose of HIPAA compliance is to protect patient health information like their social security numbers, their credit card numbers, their insurance ID, their diagnosis. Two totally different programs. Now, Medicare can deny services as being not medically necessary for many reasons. For example, Medicare is doing a pretty big audit right now across the country. In certain states, they're starting right now, but I have a feeling they're going to be crisscrossing the country. And they might say, we took a look at your notes, and you didn't put the patient's name or the date on the note. Well, therefore, we consider the care not medically necessary. Really? Because the date and the name is missing? Yeah, they can do that. Or you send in your notes and Medicare says, your notes are illegible. We cannot read them. Therefore, the care is not medically necessary. Regardless of what you do, if it's not following their guidelines, they can consider it not medically necessary. One of the most common reasons for them to say the care is not medically necessary is if your notes look like it's wellness care or maintenance care. Probably the most common reason. Now, if you get paid for a service that was considered or is considered not medically necessary, well, Medicare can consider that fraud or abuse. So I look at these compliance plans like homeowners insurance. You don't want to have to pay your homeowners insurance. You just, every time you get that bill, you're just saying, oh boy, again, we have to deal with this. I'm not going to have a problem with my house. Yeah, so homeowners insurance, you don't want to deal with it, but the day comes where you have a leak or some water damage, you're going to be thrilled that you have that policy in place. Same thing with Medicare compliance and HIPAA compliance. Not something that you enjoy doing or you feel like you really want to have and go through, but the day comes when you need it, you're going to be very happy that you have one. So can you substantiate that you make formal efforts to prevent billing and coding errors? Many doctors will say, well, we go to seminars, we listen to webinars, we try our best, we're a member of our state association, but do you have that in writing? And can you provide it to someone if they come knocking on your door, asking you if you make formal efforts to prevent fraud and abuse? How do you do that? How can you provide proof? A Medicare policy and procedure manual, again, also known as a Medicare OIG compliance plan, can provide the proof. So how do you start creating a Medicare compliance plan? Of course, you can do it on your own. Of course, you could hire somebody to help you with it, but let's go through it. So the Medicare compliance program that you put together in your practice, it should be based on the requirements and suggestions directly from the Office of Inspector General. They put out information on it many years ago. The program or the article that they put out in the Federal Register is called Compliance Program Guidance for Individual and Small Group Physician Practices. And it's based on these 7 essentials. Again, you need to have written policies and procedures. You need to conduct regular staff trainings and write them down. You have to have open lines of communication. You should name a compliance officer, conduct internal audits and reviews of your notes. I'm going to go through all of these in a few minutes and show you some sample policies. Respond promptly to detected offenses and take appropriate action, and enforce proper disciplinary practices. So before I show you the specific examples of these policies and procedures, let me go through some of these common audit triggers that are occurring right now. If you are performing some of these things, again, it can trigger an audit, and that's where you might have to produce a Medicare policy and procedure manual. So, as I mentioned, Medicare is doing some major audits across the country right now. If you haven't been audited, you probably know somebody that's being audited, especially in certain states on the East Coast right now. There are a few states that are being hit pretty hard, a couple on the West Coast, just a couple in the middle of the country, but I have a feeling this is going to be spreading throughout most of the country. So they're sending out audit letters to many chiropractors across the country. I've had the opportunity to review these letters and to speak to many of these doctors. So I want to share with you, first of all, why they're doing it. This particular audit that's going on right now, it relates to a 2015 OIG report that stated $76 million for chiropractic services were questionable, and another $21 million was improperly paid due to lack of documenting the proper primary diagnosis. There's an easy fix right there. Make sure you're documenting the proper primary diagnosis. And again, these other OIG reports reveal high rates of improper payments for chiropractic services. So one of the things that you need to do is send in the information. So I've been getting questions from providers. Do I have to send in the information? Yes, you must submit the requested information. If you don't submit it, it's going to be considered at 100% error rate, care is not medically necessary, and they'll probably initiate overpayment recoupment for these undocumented services. Next question I get, can I charge for making copies of all these records? Because some of the doctors I'm working with, they're sending in hundreds and hundreds of pages, copies of notes. So can you charge Medicare for making copies of records? Nope. Sorry, CMS states that they are not authorized to reimburse providers for the cost of copying records. Now, do you have to submit notes for all dates of service on the claim? Well, take a look at the claim that was submitted with the date of service requested. Is there more than one date of service on the claim? If yes, you may have to submit the notes for all the dates of service on that particular claim. Each set of patient notes you should take a look at, evaluate them on a case-by-case basis to determine what information you should be sending. They're asking for progress notes. Okay, so do you have any progress notes? Do you have any exams, re-exams that can help support the medical necessity for the date of services requested? Do you have a treatment plan? They're asking for a treatment plan or a treatment record. So that should include the chief complaint, description of the condition, the part exam, the subluxations as the primary diagnosis, the frequency and duration of care, the goals to be achieved, and the objective measures that you're using to evaluate the effectiveness of chiropractic care and how you're monitoring patients' care. Are you ensuring that your records support active treatment? So the chiropractic Medicare guidelines provide details on active treatment. When submitting claims for reimbursement with active treatment, that's why you're going to use the AT modifier. If you don't use the AT modifier, the claim is automatically going to be denied. Next question I'm getting from providers is, can I make changes to my notes once they've been entered into the record? No. However, you could put together a treatment summary. This will help explain your treatment approach, clarify any vagueness, and point out the most important parts of your documentation. That's one of the most important things, I feel. If your notes are not really looking good, it's a really good idea to create a treatment summary. I've done many treatment summaries with doctors that are being audited, and they're giving me feedback that that's been the difference between them having to give back a lot of money or not having to give back any money or very little money, is the treatment summary. Okay, so now let me share with you how to start creating policies and procedures. Now, this is specifically for Medicare. If you do not see Medicare patients, you don't necessarily have to create a policy and procedure manual. I still think you should. I think it's a good idea to have your terms and conditions, so to speak, of your practice and your game plan and how you approach certain concerns. But we're talking about a mandatory policy and procedure manual specifically on Medicare patients. So I've put together a Medicare policy and procedure manual for many doctors across the country. I've come up with 18 policies and procedures. I consider these the basic policies and procedures that you have. You might need to create more depending upon your practice and where you're at. So let me show you. I think you should, start off here. Well, obviously, policy 1.1 here is authorized access of computers. You want to make sure that if a staff member, and we're talking about CAs and clinical staff members, if they don't have authorization to access your computer system, then they should not be authorizing it. And then they should be signing off on a document stating that they either do have authorization or they don't. See, if you have a problem down the road, you have proof. See, if it ever comes back to a staff member is stealing information, is committing Medicare fraud and abuse, they're taking Medicare information and selling it to their friends for fraud and abuse, if you get caught or it comes back to your practice and now you get questioned by the OIG police, so, Dr. Kotler, do you have a policy on who could enter your computer system? And you go, yes. Well, we have found out that there's a staff member. We've done an investigation. We found out that Margaret has been stealing information. Do you have a policy that Margaret looked at? Yes. Did Margaret read your policy that she should not be entering computer systems without authorization? Yes. Did she sign that policy? Yes. Well, then you are going to have much less exposure versus, oh, we didn't have Margaret sign anything. She never reviewed any policies. We don't have any policies on that. See how that changes everything? Next, with the internal auditing and reviewing, that's something that Medicare says you must do. If you see Medicare patients, you are supposed to review your Medicare charts. Now, of course, you could hire somebody to do it for you, but you don't have to do that. You can put together a checklist and take out a couple of times a year, 2 or 3 times a year, take out 2 or 3 patient notes and take a look at them and go down this checklist. Is the patient's name and date on the form? Did I write down the chief complaint? Did I put down the pain scale, the frequency of pain? Did I note the trend? Is the patient getting better? Are they the same? Are they worse? Did I palpate the areas of the subluxations that I listed? Did I use the modifiers properly? And you just go down this checklist and you just do an internal audit or internal review, and then you could score yourself. Let's say there are 30 yes or no questions. Well, out of the 30, you answered yes to 25 of them. So 25 divided by 30 times 100, that's how you get your score. And hopefully your scores will increase every time you do this. So this is how you should conduct an internal audit of your Medicare notes. Let's look at some other policies. How about the OIG exclusions list? Medicare has a website, and you can go to it. It's the exclusions.oig.hhs.gov, and this is where you're going to put in your name and see if you've been excluded from the Medicare program. Hopefully your name will not appear. Now, let's say you are a busy practice and you're looking to hire an associate. So you are required to go to this website. Here's a screenshot of the website. It's exclusions.oig.hhs.gov. You're going to go to this website, and let's say you're about to hire Dr. John Smith. Put Smith John into this website and see if his name pops up. If his name pops up, then you are not allowed to hire this person to see Medicare patients. So go to that list. You're required to go to the list. You're going to put your name. If your name does not appear, it will say, cannot find name on list. Print out that document and either scan it into your Medicare and Policy Procedure Manual if you have it digitally, or if you have a nice 3-ring binder, print out that page and insert that into your Policy and Procedure Manual. And you're going to do this for all staff members too, because Medicare knows that staff members, non-clinicians, non-doctors, staff members, office managers can be part of Medicare billing and coding fraud. They could be part of schemes that occur. So it's not just doctors you're going to put in. You're going to put in the name of every person that works for you into this website. Print out the page so you have proof. Next, you may have a policy on open adjusting rooms. Put that in writing. Here's an example. We utilize an open adjusting therapy room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room if requested. How about full spine adjusting? What's your policy? Many doctors will do a full spine adjustment. Now, if you adjust somebody's lower back and they have no pain, they have no restriction, they have full, complete ability to do all their activities of daily living, most health plans won't pay if you treat that area, even if you find a subluxation. I know that gets a little controversial for some doctors, but my recommendation is to bill insurance companies only for services that are medically necessary. Why? Because they don't pay for non-medically necessary services, and treating asymptomatic areas for removal of subluxation to prevent problems is typically not a covered service. So I put together a sample policy here. You might like it. You may want to add it to your policy and procedure manual. It says, with every patient encounter, we analyze the entire spine. During most patient encounters, we will perform chiropractic adjustments on medically necessary spinal regions, as well as on regions for supportive maintenance purposes. Our policy is to bill health plans only for covered services. Let's go through another sample policy. Oh, you are required to educate every person that works in your practice on anti-kickback statutes and the Stark Law. Anti-kickback states that you cannot pay people for referrals and receive money for referrals. For example, if an attorney ever came up to you and said, hey, I'm going to refer patients to your practice. Every time I refer you a patient, I'm expecting you to pay me $200. See, that's illegal. Now, again, I'm not an attorney. So you should check with your attorney on any of this legal stuff, but this is basic anti-kickback. And Stark Law. Stark Law says you're not allowed to refer patients from one facility that have you ownership to another facility that you have ownership, or you have a close family member that owns the facility. Classic Stark Law violation could be this. You own a chiropractic practice. Now you decide to open up a physical therapy practice down the street. And now you're going to be referring patients from your chiropractic practice to your physical therapy practice that you have ownership in. That's a Stark Law violation. Check with your attorney to make sure that you're either... Well, let's look at it this way. If you have a situation like that, you may have an attorney that was able to provide you with safe harbors and other ways to get around that. So check with your attorney. Now, if you own a chiropractic practice, and let's say you opened up a health food store, and you want to refer patients from your chiropractic practice to a health food store that you own, that's okay. Stark law relates to certain designated health services. Again, you need to educate your staff on this so they understand it and they sign off on this. Compliance concerns. Let's say you have a staff member that comes up to you and says, I have a concern with the way we're doing things here in the office. Your initial reaction should be, okay, we'll look into that. Tell me what's going on. Versus, this would be the wrong thing to do. Let's say Mary, your CA, comes up to you and says, hey, I don't think we're doing things right. You cannot retaliate. You cannot say, Mary, you are fired. No. You have to document compliance concerns, non-retaliation. That's part of your culture of compliance. That's part of educating staff members that you take everything seriously and you attempt to always do things right and make good faith efforts. But you may have a staff member. Here's an example. Beth comes up to you. She's your staff person. She comes up to the compliance officer, in this case, Debbie. Debbie is the compliance officer for the practice. Beth is a CA. Beth comes up to Debbie and says, I don't think we're collecting deductibles properly. I think we're waiving deductibles and coinsurance. I don't think we're doing that right. Debbie now takes out this compliance concern form, fills it out, and here's the action plan. Debbie says, I investigated this concern. Some of our patients have secondary plans that will pick up deductibles and coinsurance. I will monitor this concern and we'll hold a staff meeting on this topic next week. See, that's how you handle formally compliance concerns. You have that documented. You'll be able to sleep better at night. How about training logs? So again, Debbie, she's the compliance officer for the practice. On January 15th, she had a employee staff training session, and Ann attended, and Beth and Carrie and Debbie led the meeting and spoke about deductibles and coinsurance. There it is, documented. Next training was on April 15th, and Debbie hosted the meeting, and Beth and Carrie were there, and EOBs and the ABN forms were discussed. Next, on July 15th, Debbie, the compliance officer, had a meeting with Carrie. Carrie's going to be helping us with our new x-ray machine that was just bought. So we had a training on that. So these are the things. This is a very simple example of a training log. We have other different types of training logs in Excel spreadsheets and also application sharing systems. There's another policy that you should have on cell phone usage in the practice. First, you used to have the policy, and then there's the procedure. So here's the policy. All communications using cell phones during work hours must be professional standards. Employees should not use personal cell phones during work hours. We will allow some limited cell phone communication between employees and family members. Example, employees may need to check on their children when they get home from school, or employees may have sick relatives or elderly parents. That's okay. So there's the policy procedure. While at work, employees are not allowed to use their personal cell phones. Cell phones you can keep it in your locker in a bin. Keep it on silent. Main Street Chiropractic Office will not be liable for loss of personal cell phones brought into the office. Employees should be aware that cell phone conversations are not secure. No employee shall use another employee's cell phone without that person's permission. Here's your policy. Here's your procedure. And then the employee has to sign off on it right here at the bottom. It says, as a condition of initial or continued employment, I've reviewed this policy. I acknowledge it. I will report any unknown concerns. Employee signs it, dates it. Here's another one. Here's your policy on the ABN form. Policy and procedure. Policy, the ABN form, is a standard notice that we issue to Medicare patients before a covered service is provided. The purpose of the ABN form in our practice is to inform a patient that Medicare will probably not pay. Procedure, we will use the ABN form when the patient reaches chiropractic spinal manipulation. Due to lack of medical necessity, this is not going to get paid. If the treatment is maintenance care, therefore it's not medically necessary, Medicare will not reimburse. We will have the patient sign the ABN form and follow the patient's directive to submit or not submit for this non-payable service And staff members involved with Medicare billing must review this policy and procedure and sign off on it. Here's a couple of just general questions, and then we're going to wrap it up. Can you treat Medicare patients without being enrolled in the Medicare program? Absolutely not. Can you collect cash from Medicare patients without billing Medicare? Yes, once they reach maintenance care and they check option 2 on the ABN form. Have you revalidated your Medicare organizational profile within the last 3 years? If not, you're going to be asked to. Don't do it until you're asked. Can chiropractors opt out of Medicare? No. Opting out is a private contract. Chiropractors are not on the list of providers that can opt out. Can chiropractors opt out of HIPAA? Absolutely not. It's a federal program. That's mandatory. So let's go through some action steps. You need to be proactive. Medicare and your state board expects you to know. You never want to be accused of willful neglect, which means it's a reckless indifference, intentional failure, meaning you should have known but you didn't do anything about it. Again, you want to prevent problems, read your local Medicare guidelines. Read the policies from all the health plans you bill. Review them with your staff. Log these trainings into your policy and procedure manual. Attend seminars, webinars, watch videos, read books. Review your notes or have a certified coder review your notes. And a Medicare policy and procedure manual can prevent audits. It'll definitely help you sleep better at night. And it actually may improve your office efficiency. There's one doctor that I'm working with right now. She was audited by Medicare. And she found that what the doctor was doing in the back was different than what the front desk billing person was entering into the computer on a few visits. So I helped her create this communication system between the doctor in the back of the office and the front desk CA to improve billing procedures. So just a few closing comments. Please check with all the carriers you bill prior to submitting claims based on this information. We can't guarantee that this information will guarantee payment from any insurance company or patient. Target coding is not responsible for any changes that may occur following this presentation. So it's important to do your best to stay on top of these changes by attending seminars, attend webinars, join your national and state professional associations. Here's our contact information. Email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Our HIPAA secure fax number is 844-831-2347. I say that because many doctors are sending us patient files to review. If you send it to our HIPAA secure fax number, you don't have to white out or black out the patient names or diagnosis codes. Be careful the way you send information out. And before we get to questions and answers, we offer a Medicare compliance manual here at Target Coding. It's pretty simple, pretty basic. It's about 35-40 pages. I showed you samples of the policies and procedures that are in it, but we customize them for your practice. We give you all the audit tools, all the correction action guidance forms, templates, training logs, incident report forms, employee attestations. We give you all the recent Medicare alerts and bulletins. Let us know if you're interested in that. We also offer a full comprehensive HIPAA compliance program, and our HIPAA compliance program includes the Medicare policy and procedure manual. So let us know if you're interested. The HIPAA compliance program is different than Medicare, right? Medicare is to prevent billing and coding errors. HIPAA is to protect patient health information from the cyber criminals that are out there. So the HIPAA program includes a comprehensive security risk analysis with detailed report and action plan, cloud-based storage for all your HIPAA policies and procedures, and you get a hard copy 3-ring binder. See, some of our clients, they want hard copy paper forms. Some of our clients like to go paperless and have everything digital in the cloud. So what we've decided to do is give all of our clients both the digital version and the hard copy version. We also have about 25 compliance training, HIPAA compliance training videos for clinical and staff members. We can have your staff members go through some simple HIPAA tests, and you can get a nice little certificate of completion. We can help you attract your business associates. Let us know if you're interested in that. And then we also have a book that we sell. This is our best-selling book on the best chiropractic CPT codes and ICD-10 codes to improve reimbursement. It shows you how to pair your diagnosis codes and CPT codes, like pairing food and wine. My recommendation is to pair your CPT codes and diagnosis codes. It's also a good idea to know which codes pay for the most visits. We call those the long-term treatment diagnosis codes. It's a good idea to have that list. We also have a little cheat sheet. We have 5 cheat sheets for spinal problems, extremity problems, headaches, ribs, sacroiliac joint issues, complicating contributing factors, and personal injury cheat sheets. We also have a section of the book on how to substantiate the diagnosis codes you use. For example, if you're going to diagnose a patient with cervical radiculopathy, we give you some guidance here. Do some Jackson compression or Valsalva foraminal compression. Check reflexes, see if there's any myotomal weakness. Check for range of motion and subluxations. If you're going to diagnose a patient with, let's say, cervical brachial syndrome, do Wright's test, Atson's test. Again, look for muscle strength, myotomal weakness. Look for forward head posture, thoracic kyphosis, rounded shoulders. It's a nice way to help support your diagnosis codes. Then we have a section, FAQs. Here, some doctors, they don't know the difference between a disc disorder and a disc displacement. And I'm talking about providers that are in practice 25, 30 years. They go, Marty, what's the difference between radiculitis, radiculopathy, and myelopathy? You would think after 25 years in practice, but hey, I'm still learning things. It's okay to continue to learn. It's okay not to know. What's the difference between cervical brachial syndrome and cervical radiculitis? Some of these items were asked by my clients. I didn't know the answer. I'm the code geek, not the clinical guru, so I went and find out all these answers to these common questions, like what's the difference between myalgia, myositis, myofasciitis? What's the difference between idiopathic scoliosis and thoracogenic scoliosis? So we have a great FAQ section. We offer webinars. Some are free. Many are CE approved in many states. We do seminars around the country. We have a whole bunch of seminars coming up soon. We also offer memberships. Those of you that would like to be able to email us questions at any time and get your answers within 24 to 48 hours, plus a few other items here. That's our basic membership. It's $99 a month. You can stop and start at any time. And then we have our gold membership. This is our 1-year membership program where you get a comprehensive review of your codes, your fees, your SOAP notes, your intake forms, your HIPAA forms. This includes a Medicare policy and procedure manual. Get access to all of our webinars, live and recorded, our customizable digital forms and templates, access to the member-only section of the website. And then we have a platinum membership. So we offer a lot of things here at Target Coding. And here's our contact information. Email info@targetcoding.com. Website targetcoding.com. Telephone number 1-800-270-7044. Fax 1-844-831-2347. I want to thank everybody for attending. I hope you learned a lot.